Dicarbonate buffer system. This is main and fastest buffer in the bud. Carbon dioxide mixed with water to form carbonic acid. These acids can break into hydrogen ions or dicarbon dioxide. An enzyme called carbonic anhydrase helps speed this up in the bud cell. If bud is too acidic or low pH, there are too many hydrogen ions. They combine with dicarbonate to make carbonic acid, which turn into carbon dioxide and waters. The carbon dioxide is beeped out, helping raising the pH. If the bud is too basic, high pH, carbonic acid break apart to release hydrogen ions, help lower the pH. This system helps keeping the bud pH stable, especially during changes in breathing and body activities. Protein buffer systems. Protein, especially hemoglobin in the red blood cell, help to control pH by pick up or give off hydrogen ions. In the body tissues, hemoglobin give off oxygen and pick up hydrogen ions, helping to stop the blood from becoming acidic. In the lung, hemoglobin let go of hydrogen ions, which join with bicarbonate that form carbonic acid. This turn into carbon dioxide and water. The carbon dioxide is exhaled. This system helps keeping the pH steady inside cell and help hemoglobin to carry oxygen well. Phosphate buffer systems. This system works mostly in kidney and inside the cells. It uses two forms of phosphate, including dihydrogen phosphate and monohydrogen phosphate. If the pH is too low or acidic, dihydrogen phosphate gives off hydrogen ions to balance the acid. If the pH is too high, acidic, monohydrogen phosphate take in hydrogen ions to balance the pH. This system works slowly than dicarbonate system, but it's very important to remove acid in urines and for keeping the cell healthy. Respiratory regulations. The lung help control the pH by changing the amount of carbon dioxide in our blood. If breathing is slow or carbon dioxide is built up, more carbonic acid is formed, making more hydrogen ions and lower the pH. If breathing is fast or carbon dioxide is lost, less carbonic acid is formed, fewer hydrogen ions, and pH it go up. The body can change how fast we breathe to fix pH problem.
Last but not least, I'm going to talk about Henderson-Hasselbalch equation. This equation shows how pH depends on the ratio of base, which is bicarbonate to acid, which is carbonic acid. And the equation is pH equal pKa plus log time bicarbonate over carbonic acid. If bicarbonate goes up, pH raises. If carbonic acid or oxygen increase, pH drop. Doctors use this formula to check acid-base balance and guide treatment, especially during surgery or in the ICU. Lastly, I'm going to talk about imbalance. When the balance is off, it leads to acidosis or alkalosis. For example, in respiratory, in the acidosis, carbon dioxide builds up like in lung disease, making pH drop, kidney remove hydrogen ion and keep bicarbonate. Whereas in alkalosis, too much oxygen is lost during hyperventilation, making pH rise. Carbon dioxide hold on to hydrogen ion and excrete bicarbonate. Another example is metabolic. In the acidosis, causing by too much acid or a loss of bicarbonate, lung try to fix it by making us breathing faster. but in alkalosis happening after vomiting or excess of bicarbonate. Lungs slow down breathing, kidney get rid of bicarbonate. So overall, acidosis slows down body, causing fatigue and irregular heartbeat. And alkalosis overstimulates the nerve, leading to twitching or seizure. Both can be dangerous without quick treatment.
And for the real-world applications and benefits, medical diagnosings and treatments, blood pH is crucial for diagnosing and managing diseases. For example, blood pressure measurements help detect and monitor conditions like diabetes and chronic kidney diseases. By assessing blood pH, healthcare providers can adjust treatments to stabilize patients and prevent complications. And secondly, in hospital, medical devices like ventilators or blood analyzers rely on real-time blood pH data. These machines automatically adjust care based on a patient's blood pH to ensure treatment like oxygen delivery and dialysis are safe and effective. The body pH plays a big role in how medications work. When developing drugs, companies design formulas that remain stable and effective in the body pH range. This ensures the medications are absorbed properly and deliver the right effects. Lastly, hyperventilations and pH regulations. Hyperventilation occurs when someone breathes rapidly, causing excessive loss of carbon dioxide. This lowers carbonic acid levels in the blood, leading to respiratory alkalosis, which raises blood pH. Controlled hyperventilations can be used in some medical emergencies to reduce high carbon dioxide levels.
So how does it affect people's health? The human body needs to maintain a stable pH, especially because enzymes work well at a specific pH range, or the enzyme cannot function, affecting overall health. A pH drop below 7.35 will cause acidosis. In respiratory acidosis, the lung can't remove enough carbon dioxide, which forms carbonic acid and lower pH. The carbonic acid formed by carbon dioxide react with water, so this can lead to fatigue, confusion, or even coma. Metabolic acidosis caused by kidney failure or cellular diarrhea, and lower pH and affecting heart function. So this can cause risks such as diabetes, lung disease, or kidney failure. On the other hand, if pH rise above 7.35, alkalosis occurs. Respiratory alkalosis is often due to hyperventilation from anxiety, which removes too much carbon dioxide and raises pH. Metabolic alkalosis can result from vomiting, which removes stomach acid. Symptoms of alkalosis include muscle cramp, numbness, and a rapid heartbeat. So the risks that can occur are vomiting, diuretic use, and hyperventilation.
So in conclusion, maintaining blood pH is a vital function that depends on chemistry, especially buffer system, like bicarbonate, protein, and phosphate buffer. The lung and kidney also play a big role in regulation. Problems like acidosis and alkalosis can harm the brain, muscle, and heart, but understanding the chemistry of it can help the doctor, scientists, and environmentalists protect life.